Hello, this is Tate Steckman. I am going to be testing off on the IV insertion, the IV peripheral insertion. Gonna wash my hands real quick, and then let's verify some orders. I see we have Frank Miller here. Date of birth is 7/4/1958. He's in room 1234. Dr. Welby's taking care of him. It says here that he's allergic to penicillin and atorvastatin. And for one of his treatments, we are to insert a peripheral IV as necessary. We see that he does not have an IV in place right now, so what we'll do is we'll insert that IV. Once that's all done, once we've verified all those orders, I will gather up some supplies. So I have a supplies room right over here. I will grab a tourniquet, this extension tubing, or the J-loop right here, this Tegaderm, some saline flushes, this is like normal saline, not expired. I got enough to flush out that IV, and then a 22 gauge IV needle here, along with some tape and some 2x2 dressings right over here. We also are going to need this chlorhexidine scrub. I'm also bringing in a pencil and some good sized gloves so that I can operate with everything. Once we have all of that, we'll introduce ourselves. Knock, knock, knock. Hello, Frank. My name's Tate. I'll be your student nurse. Can you tell me your name and date of birth? He says Frank Miller. Date of birth is 07/4/1958. That matches up. Frank, can you tell me if you have any allergies? He should say that he has allergies to atorvastatin and penicillin, but if he doesn't, I'll double check with him and double check with the chart. You did say that you're allergic to atorvastatin and penicillin. Great, we won't be giving you that, but what we will be giving you today is a peripheral IV. That'll just help diffuse some medication into your system in a different route. So, is there a preference on which arm you'd like to use? He says no. Awesome, we'll use this right arm. Let me just take a peek and see, check out your arm. Let's see if there's any swelling or anything like that. No, this is looking great. I see that you have a really good vein right here, so we're gonna target this one, okay? Awesome, well, thank you so much. I'm gonna go back over here and get my supplies already. I just like wearing gloves when I work with patients, so I'm gonna put some gloves on. Right, the first thing that we're gonna do is we're gonna use this chlorhexidine scrub to make sure that it's all clean on your site, okay? So this is the chlorhexidine scrub. We're gonna squeeze it, pop it, great. We're gonna suds up this area with good chlorhexidine for 30 whole seconds, okay? 1 and 2, 3, 4, 5, 6, 7, Awesome. Good deal, Frank. So we're gonna let that dry, air dry. While that's air drying, I'm gonna take this extension tubing. This will be sealed and very sterile. So first thing that I'll do is I'll loosen up this little white cap here and open this on up. I'm gonna take this saline syringe, make sure that there's no air bubbles in there. None, good. We'll attach this onto here and pump this up with a little bit of saline. Great, so it's all flushed on the way through. This is gonna go off the side over here. We're gonna prepare our Tegaderm too. Whoops, oh my goodness. So that fell on the floor. We're not gonna use that one, Frank. I'm gonna call my CNA and we'll get a new one. This is a new Tegaderm. Contain it, don't flip. Awesome, Frank. Now what we're gonna do is just peel this on back, sticky side up, and not touch the stickiness. Awesome, good. Then we're also gonna use some tape on you, just to secure that IV once it's all done. Gonna put that on your table here. Maybe 2 pieces just in case. Alright, awesome. Now, we're all set, and we have the gauze there. Fluohexadine's done, getting all dried up. Awesome. We're gonna put this tourniquet around you, okay? And using that quick release technique, get that all moving around. You watched the big game last night, Frank? You did. Yeah, they won. Woo! All right. We did that. We're gonna allow the tourniquet to stay on for no more than 2 minutes. Excuse me. Alrighty, Frank. You might feel a small little poke here as we insert this IV, okay? Just gonna wiggle this on off here. Good. So the bevel's up, inserting at 90 or 30 degrees. Making that skin taut. Insert a small little poke. Good. We got a flash. Insert it 1/8 of an inch, and then slowly just start advancing that IV catheter on in, making sure not to touch any of that stuff. Great. Awesome. Sharps away. This is away. Let's get this extension tooling. Oopsies. Undo that little white piece. Great stuff. Awesome. That's all set. This will just kind of hang out here for a little bit. We won't contaminate that little area, and if we did, we'd have to chlorhexidine it. We're gonna take this. Oops. I contaminated that, so what we'll do is I'll call for my CNA. Get another tightener out here. All right, so let's just say I have a new tightener here. I'll open this on up. Grab the sides over here and open that on up. Clean this to make sure that there's no spot, no blood underneath here. Good. So grab this and place it on top. This is the new one. Good deal. Awesome. Just gonna peel this off and around here. Great. Now once that's all done, what we're gonna do is aspirate for some blood return. And we see some, so we'll pulsate in 2 to 5 mLs of normal saline. I'm gonna give you a 3 here, buddy. Awesome, thank you. So now what we'll do is I'm just gonna tape this to secure it over here. Take this on off. This can go in the biohazard. This can go in the sharps. We should have a little label here that we'll put on the Tegaderm, just to say what time and or what day we put this on. There we go. Oops. Say my initials and the date's 9/5. And then we're all set. So then we would document that it was a 22 gauge needle that, please move away, that we inserted it in one attempt, that there was a Tegaderm on it, that's all sealed up and all set to go. Great, thank you.